My name is Peter Propp from Halespring, and without further ado, Michael Hermus, CEO and founder of Halespring.
Awesome. Thank you very much, Peter. Welcome, everybody. And we're very glad that you decided to join us here for what we hope is going to be an informative but also practically useful session. As Peter mentioned, I'm Mike Hermus, the CEO of Halespring. And our goal today is to show why we think Halespring is going to be a game changer, but also to actually demonstrate how it works, right? And with that in mind, let's go over our brief agenda for this session. I'm going to do a brief intro and talk about how we got here. Then I'm going to hand it over to Dr. Frank Appah, who's our lead clinical advisor, and he's going to talk about the clinician's perspective and walk through a case study. Then I'm going to walk through an actual demonstration of the platform. And finally, we're going to do some question and answers. If folks have questions, hopefully we can answer them. So with that, we want to be very respectful of your time. So we're going to launch right in. As you can see from this slide here, right, our ultimate goal here at Halespring is to improve patient outcomes. We want to help mental health providers improve patient outcomes. And many of you already understand the need for Halespring, but I just kind of want to reinforce our overall mission and how we got here. As I've mentioned in other venues, I am a father, and one of my children has struggled with significant mental health issues for the better part of a decade. And through our family's journey, navigating this complex system, trying to find the right care, communicating with providers, and all the associated complexities, right? We learned a lot about what's working and what's not working so well in the behavioral health ecosystem. Right now, too many people we know struggle to find the right mental health care for their situation, especially if that situation is complex, if it's more complex than really the basic need for therapy. We know that people often have multiple providers when they're seeking care, right? And right now, when that happens, we know that the counselors, psychiatrists, the therapists, and others who are all teamed up to help their patients struggle to communicate or collaborate with each other because they don't have a HIPAA-compliant way to do so. And we also know in that same vein, patients and families like myself need to communicate important information to those healthcare providers. But they find themselves kind of at the center of this very complex, tangled web of phone calls, emails, texts, which is, I can say from personal experience, highly stressful, highly inefficient, and usually not that effective, right? So all these things ultimately lead to less effective patient care, and that can clearly lead to worse patient outcomes. And that's what we want to try to improve and what we want to try to help with. And that's why we built Halespring. Clearly, we're not the first or the only folks who want to do this in the mental health ecosystem, but our focus is a little bit unique in that we're really focusing on connections, on communication, and on collaboration. And we think that our HIPAA compliant software platform can really make life easier and better for both the mental health providers and patients and families. And with that, I'd love to turn it over to, as I mentioned, Dr. Frank Appah, who's an accomplished clinical psychiatrist who has his own practice and also happens to be an instructor at the Yale School of Medicine. He's been working with Halespring, as I mentioned, as our lead clinical advisor, and he's going to share his professional perspective along with a nice case study. Take it away, Frank.
Thanks, Mike. Hi, everyone. My name is Frank Appah, as you know, and I'm a psychiatrist in private practice in Westport since 2014. And I'm grateful to be part of this webinar to discuss Halespring, which is a truly innovative approach to mental health collaborative care. So my involvement with Halespring began in November 2023, when Mike and Joshua Udow invited me to join a focus group. And I was very excited by its potential right away and welcomed the opportunity to take on an advisory role. Why? Because it was clear to me that Halespring offers a solution to the challenges many of us as providers encounter as community-based clinicians. So now, rather than just describing these challenges, I want to illustrate them through a clinical vignette that many of you will be able to relate to. Okay, next slide. So this is about Sandy. So Sandy is a 19-year-old college student and chemistry major with OCD, a history of depression, and a previous suicide attempt. And during a session with her therapist, Sandy endorsed passive suicidal ideation and reported worsening checking behaviors, so she was unable to leave her college dorm. She was also struggling academically, which she attributed to inattention. Now, her therapist and I strongly recommended a medical leave. However, Sandy was quite hesitant. She didn't want to withdraw from classes without a plan that she believed would ensure her time was well spent and would effectively address all of her needs: her OCD, her depression, and her inattention. Now, she had only 3 days to withdraw to avoid academic repercussions. So that meant that we needed to come up with a plan immediately. Next slide. So to help Sandy and clients like her navigate crisis, we generally follow this approach. First step would be initial conferencing, where we collaborate to assess each client's needs. Then there's planning, which involves determining treatment options and making referrals. And finally, care coordination and aftercare, providing ongoing support, adjusting treatment plan as needed, and ensuring a smooth transition to aftercare. Next slide. Now, step one generally involves case formulation, asking, how do we understand Sandy's situation to get a clear sense of her needs? In addition to her depression and OCD, she was also struggling with inattention. So it was essential that our plan address all of these concerns in order for her to have buy-in. So this step necessarily involved that we had to reach out to campus health as part of safety planning. Now, as you can imagine, this required numerous text exchanges, emails, phone calls between myself, the therapist, and campus health. Next slide. And now, as part of her planning, we had to find the right specialized care for Sandy. We curbsided colleagues, conducted Google searches, even reached out to Facebook groups for mental health providers. And once we identified the appropriate resources, we had to determine availability of various programs and clinical psychologists. And of course, we had to send referrals. This required even more texts, phone calls, emails, faxes, online searches, all of it. Next. So now, once Sandy agreed to admission into a residential program, her retreatment required ongoing conferencing with the people at the residential program. We needed regular status updates and the establishment of aftercare and follow-up. For this, video conferencing, texts, phone calls, emails, telepathy, smoke signals, everything, right? And I think we all know how that goes. Next slide. Yes, so now through our collaborative efforts, we were able to arrive at a plan 2 days before Sandy's withdrawal deadline that addressed her critical needs and concerns. As I mentioned, this included a 3-month residential program, followed by an intensive outpatient program after discharge. And she also participated in the executive function coaching before returning to school the following semester. Next slide. So thus we were able to implement crisis planning, identify specialized care, and address Sandy's academic and treatment goals. Next slide. So now these 3 steps that we went through required extensive collaboration with multiple providers to ensure timely, client-centered care. And each of those lines represent multiple forms of communication, whether that be text, emails, phone calls, video conferencing, whatever, all right? However, this process, as you know, and I'm sure you've experienced, is often fragmented and inefficient. Scattered communication across multiple platforms, delays or lost critical updates, and time-consuming and cumbersome coordination. Next slide. Yeah, so Halespring offers a streamlined approach. So a secure, centralized platform for providers, seamless and inefficient collaboration, and timely updates that enhance client care and outcomes. Next slide. So in summary, Halespring offers enhanced provider collaboration, enables secure messaging, and allows providers to join discussion groups and connect with peers, a streamlined referral process, and most importantly, a secure HIPAA-compliant platform that protects patient data and ensures privacy. And ultimately, all of this together is sure to improve patient outcomes. So this is why I'm excited to be involved. So Mike, I'll hand it off to Mike. So if you can give a demo of the platform.
Thank you so much, Frank. That was fantastic. Really appreciate that perspective. As you can see here from this slide, we're going to overview a few of the key features that the Halespring platform offers, and Frank alluded to many of them already. So now we're going to get a chance to see them in action. So I'm going to go ahead and share a video that we've created for this purpose in order to streamline any back and forth, logging in, logging out. We've edited a little bit so it's a little bit smoother. I may pause it at times here to try to give you, a little bit of color, but we're just going to run through that right now. This video starts with, of course, the easy sign-up process. Doesn't require a credit card or any detailed information to sign up. All you have to do is give us your email and a little bit of information. You will get an email confirmation that allows you to log in after that without much ado. Okay, that is, as I said, is free for the basic account. So once you log in, you'll see a screen that looks something like this. Again, there's a lot here. It looks a little scary, but ultimately it's actually trying to orient you on some of the key actions that you can take when you first log in and create an account. The most important or the most basic of those is the profile. You'll see right there on the right-hand side. We have the ability to access your profile. And when you go there, you'll see something that looks like this. Obviously, it won't have your face or an image on there yet, but it allows you to completely customize all the information about you that shows up in the Halespring system. This information will be viewable, visible on the internet to prospective patients, clients, as well as to your peers and colleagues, right, which can also help them network with you. So, of course, you can edit your basic biographical information. There's the ability to actually do some more complex content here, such as bullets and links and things like that, and put whatever you like in there. Then, of course, we've got your basic name, your basic personal information, and then critically, your professional profile, where you can enter in your professional credentials. We've tried to be comprehensive here. If you find some that aren't on here, you can feel free to let us know. And you can also enter in what client types you see and what your specializations are. Again, tried to have a comprehensive list here, but it's possible that we've missed something. You can also control if your profile is listed or not, okay? So all of that goes here in your professional profile. You can then edit your what we call practice information. And this practice information includes important things like which state you practice in, not necessarily where your office is located, but where you're licensed to practice. And that will help both colleagues and potential patients find you through the profile. You can also input your insurance information and whether or not you accept insurance, for example. You can put in your information, your education, if you're so inclined. You don't have to. You can also put in things like your service fees on your profile if you're so inclined, also optional, as well as professional affiliations and professional certifications. Finally, you can put in your professional contact info, which would really be, again, your office and office phone number and email if you have one. Now we're going to dive right into the networking functionality. Again, it's great to have your profile out there, but one of the core value propositions of the Halespring platform is the ability to grow and manage your professional network, similar to what LinkedIn has done for the broader professional community. This is really designed, though, for behavioral and mental health professionals specifically. So, of course, you can see here all your connections. You can click a connection and see their information, and there are several actions that you can take with those connections. We're going to highlight a few of those in a bit here. You'll see certain tags about them. They're following you. You're connected to them, and things like that, okay? One of the things you can do on here is you can actually favorite users. If you want to have a list of people that you work with on a regular basis, you can simply favorite them. There's this little star here. You can favorite them or unfavorite them, and that will show up in your favorites list right here. Very, very straightforward. You can see here we're going to add a new favorite for Alfred. Just click the button, confirm it, and he is now in our favorites list, as you'll see here. So very basic, but can be quite useful. So, as I mentioned, favorites, there also are things that are called tags in the system. And these are actually, as you can see here, little bits of information about a connection that you can actually completely customize. So in this case, we've got a therapist tag that we've created, which we can associate with anybody who happens to be a therapist. We have a high risk tag that we've associated, who could be anybody who handles high risk patients. So again, it may be a useful tool for you to manage your network. Again, when you click a contact here, you can see all the information they have in their profile in a nice, easy to use fashion, which is just convenient if you need to orient yourself. Here, you'll see we can take notes on a user. So again, these are private to you, can be something to recall previous interactions or things that you've noted about this particular colleague. You can also create what we call a recommendation, similar to what you might get on a LinkedIn profile. This would be a public comment on a user's profile if that user accepts it and allows it to be displayed. For any user you have, you can click that little direct message icon, and all of a sudden you are in a HIPAA-compliant, secure direct chat with that user. So in this case, for example, we can share, assuming it's appropriate based on patient relationships, patient notes for something, a case that we are collaborating on together in this very simple fashion. So again, all that is HIPAA compliant and secure. You can also increase and expand your network through finding other users. So in this case, there's a suggested user list here that showcases people who may be near you or have similar characteristics to you. You can click that user and then click that little button there that says invite to connect. And in this case, I am inviting Frank to connect. You can associate a little message, and then that user will receive both a notification on their home screen up in that little upper right-hand corner there, and also be notified often via email if they have that in their settings. They can then accept or decline the invitation. If they accept it, you as a user will get notified of that as well, which we'll see in a bit here. So Frank's now sending me a message. I will log back into my account and see that I've gotten a notification that Frank's accepted my request. I can see I was notified via these blue dots, which show up where there is unread activity, that Frank has sent me a message. And right here from this direct message tab, I can respond to him very quickly and easily. We can also, again, find users in other ways. So that suggested tab is one way. There's a find button that allows you to search for users by name. So if you happen to know somebody that's on the platform and you want to find them, you can do that. That will bring up their profile card. And again, you can simply click it and invite them to connect that way. Or if you know that somebody is not on the platform, you can send them an email via the platform to invite them to connect. Simply click that little invite with an email icon on it, enter their email address there, and give them a brief message, and then click invite. That will actually send them an email to that address that will invite them to both join the platform and also connect with you. You can see, and here's what the email looks like that somebody will receive if you use that feature. So they can click that sign up button and it'll take them straight to the sign up page. And once they sign up, they will actually be given an invitation to connect with you. So that's a handy way of getting more people on the platform that aren't on there just yet. So another really important piece of functionality is what we call the group functionality. And again, you can navigate there via the menu on the upper right. There is also a shortcut there as well. This shows you all the groups that you may have joined, groups that you may be suggested to join, but there's also a feature for searching for groups. So in this case, we're going to search for a group that's got Fairfield in the name. We find that group, we click it, and then if it's a group that is open for anyone to join, you can simply click the join button, and that will allow you to join. However, not all groups are, and now we will show you how you can create a group. Very simply, you can create a new group with that button, upper right-hand side of the groups application. You can name it, you can give it a description, you can tell us who is allowed to join without approval, and you can also tell us who can apply to join. So in this case, we've said nobody can join without approval, and anybody can apply to join this group. It's possible to set the group so that only For example, folks with verified identities can join the group to avoid having spam accounts mess up the conversation. So we will simply create this group here. And now I have a brand new group that I manage, and I can go in there and I can play around with it. I can see that I am the only member currently. I can add new topics to my group. So topics are like little separate conversation streams that we can use to segment our conversations. In this case, I created one called Latest Research. I can, at any level of this group, I can post content just like you would in a Facebook group. And it's very straightforward. I can share images, very, very easy to do. And for example, we'll show if we jump into the research channel that I can actually post links to articles, for example. Very useful, as you might imagine. Clicking that link will just take me straight to the article. So this is kind of a basic functionality. You can then repost that to the home channel if you'd like. But more importantly, you want other users to join your group, right? So if somebody searches for this group using the word demo, because that's what we called it, again, they can click that. They can, now you'll see it says apply instead of join. They will click the apply button, type a brief message that the group administrators will see. Their application has been created, which they can then see in their own group application. They can see that they have an outgoing application for this group. And on the other side, the group administrator of the group that we just created, which is me, will see that I've got an incoming application from Tom, and I can approve or decline this application. In this case, I'll approve it, and that will immediately join Tom to the group, and he will actually get a notification that he has been accepted to the group. So you'll see that here. He gets a notification. You can then go straight to the group. He'll notice again, I've got that blue dot because there is content that Tom has not yet read, has not viewed. So he can see all the content we created. He can interact with that content. He can post his own content to this group. Very straightforward, but obviously can be quite powerful for collaboration. Now, something that I think is really unique to Halespring, the Halespring platform, and we think is going to be very powerful for the provider community, are our referrals. We all know that currently referrals are managed on things like Facebook groups, email lists. They are not really very secure. They're not super effective, can be cumbersome in many ways. So we've created a comprehensive referral exchange platform here on Halespring that allows you to create a new referral. You can see here, you can enter in a summary title, you can enter in a more detailed description. You can talk about what kind of collaboration, what kind of referral it may be, whether it's a new client or unique collaboration, the client type, gender, location, and of course, you can put in the type of issues that you're seeking help with, or that the patient needs help with. All those will go into the referral record. You can share things like high-risk behaviors. Is there family support? Does the client have a preference in provider, for example? And of course, the all-important insurance information. All of that goes into a referral record that is then stored in the Halespring platform. And now you have a referral record for your cases that you can edit, and you can also share wherever you feel appropriate. So I can share this to any group that I'm a part of. In this case, I'll share it to that Fairfield County's providers group, or I'm sorry, the demo test group. And when you share it, it'll post into that group, and anybody who's in the group can see it. So when I go and look at it, it looks like this. You can see that I posted into the group, and it included that referral record with some of the important information about that referral. Now, this is my view. If somebody else in the group, another group member who's not me, looks at it, they will see the same record, but now you see there's a button that says express interest. This allows them very easily to send me a message that says they are interested in this referral. When that happens, it creates a direct, secure chat between the referring party and the person who's interested. And this allows them to now coordinate information in order to determine whether or not this referral is a good fit. As the referring party, I will get notified that this has happened. You'll see the blue dots again. I can go straight to the chat and now I see the conversation. So here in this chat, again, we can share information as appropriate based on the patient relationship. We can do a video call if we want to, and we can share documents if appropriate and necessary. So this is a nice, clean, easy, secure, and organized way to communicate about any potential referrals and ensure that you can get a better fit for your referrals. You also have the ability to search for referrals in the platform. So you may see a referral because someone shared it to a group you're a part of, but you can also do a proactive referral search using any of the criteria that you saw in that referral record that we created. So you can search based on distance to your location. If you're looking for in-person clients, you can search based on their conditions or treatment areas. You can search based on what their preferred provider characteristics are, and of course, on insurance characteristics. All these things can be searched. You will then get a list of matching referral records. And for each one of those, you can click it, get the detailed information. And if you have not already expressed interest in that, you can express interest for that referral right here from the search screen. In this case, I've already expressed interest, so now I can view the chat between myself and the other provider that has already been going on. So that's how referrals work. And again, we think that's a very powerful feature. Now I want to talk a little bit about teams. Teams are a primary mechanism for driving the collaboration that Frank referred to in his vignette. Teams are similar to what Slack or Microsoft Teams is, if you've ever used those tools. But in this case, they're very decentralized, and you can create a team with anybody else on the platform, okay? And you can have more than one team. And this allows us to assemble groups of people who are working together on something, some shared set of patients, some shared research project, whatever the case may be. You can create a team for that. And this is now a real-time communication and collaboration tool that allows us, again, to have separate channels and topics. It can actually here, as you can see, you can create channels for individual cases or clients if the team members actually share clients that they work on together. And the interesting thing about those is that they don't have to be the same people that are in the team. It can be a subset of those people based on ROIs. So obviously you can type information here. Any comment you type in here will go to the entire team. If you're online, this will all be in real time. So it's not like waiting for posts to show up. You can, when you comment, it's like more of like a thread structure than it is in a Facebook group. Again, all designed to be more effective in a real-time collaboration environment. Here I can see threads that have been started by myself or other people, and an easy way to comment directly on them. You can see all the members of the team, and so similar to a group in that regard, but again, it's more real-time. If I want to invite somebody to join directly into my team, I can simply look them up in the platform. Do that with Frank again. I will just double check Frank's profile here to make sure this is actually the person that I was looking to invite. Then we can invite Frank to the team.
And that's not really my profile.
That's not really Frank's profile. That's correct. Sorry, this is a demo environment. If that wasn't clear, I apologize. Frank's got a much more robust profile. So Frank, the fake Frank in this case, will receive a notification that he was invited. He will now have the ability to accept or decline that invitation. If he accepts it, he will be immediately placed in that team. Again, he can see these blue dots are content that he has not yet viewed. So he can go in, look at all the content in this team. He can browse through the different topics. He can interact with the obviously existing content here. He's going to comment on that thread that I just created. And again, this is a very, very powerful tool that allows for multifaceted communication and collaboration across whatever purposes might suit you. Here, Frank's browsing through everything, interacting, liking. He can also see the members of the team, and of course, can comment directly on threads from here as well. So I will go back to my user account here. And again, I will be notified of new activity if I wasn't on the platform at the time. I see that Frank commented on this thread, and I'm like, great, that makes sense to me as well. So again, just a very useful and flexible tool for communication. Here is an example of us looking at the client channel. And you'll notice, again, there's on the upper right-hand side, you see that there's two icons that are part of this channel because those are the only two people that are allowed to view Bob Smith's information. If I click Tom Thompson, I see three people. It's a different set of people. Those folks have releases to discuss Tom's patient information. So it's a very powerful tool for collaboration. If you have shared clients that may not always be the exact same set of people, you can still keep them all on the same team. And in here, of course, we can do the same things we talked about earlier. We can share notes, we can share documents, we can do video calls and other sorts of features for collaboration. Finally, I want to overview some of the AI features that we have in the platform. I know some people think AI is a little scary, but one of the things that's scary about AI when you use it publicly is that it's not always secure. It's not appropriate typically for using in contexts like this. So here at Halespring, we actually have incorporated really powerful large language model AI into the tool in a secure and HIPAA compliant way. So for example, you can use this to summarize any documents. In this case, I'm going to summarize simply a public study, but you could use it to summarize confidential patient notes in this context, and it would be HIPAA compliant. So when we do it, we just upload the document, we ask the AI to summarize it, and what we will do is the AI will respond to us, and it'll give us a very nice summary of the document. And again, depending on the complexity of the document and how much information is in there, you can actually interrogate it to clarify further. So I got a summary, now I want to ask what the most important two findings are from the study, and it'll tell us. It's very, very powerful stuff. And again, I want to say this is a language model that has been developed by a third party that's vetted and very, very powerful. And we are simply taking advantage of that. This is also a way for us to summarize conversations in the channel itself. So if I want to summarize the conversation on this thread, I can ask the AI to do that. A very helpful way if you have a long conversation that you haven't been paying attention to, for getting a quick summary of what's happened while you were not paying attention, okay? In this case, obviously, it's not as useful as it would be in a real clinical setting, but very powerful nonetheless. You can also use AI in direct messages. You can simply, in this case, I'm gonna send fake Frank a direct message and use it to send him a different study and summarize that for him, so he doesn't have to waste his valuable time opening the document and reading, all 20 or 30 or 40 pages. We can just send him the summary, and if he wants to dive into the document, he can choose to do so. But now he gets a very, very powerful summary right in this direct message. So again, something that can be used in any number of use cases, depending on your clinical environment. I can also ask as we said, we can summarize conversations. This is another example of creating a separate AI chat to do that, so we don't have to clutter up our main chat. We can actually use it like a chat GPT window where we just create separate discussions with the AI itself. And I can use that to either summarize the conversation for the channel this is associated with, or ask it to summarize documents like we discussed. But I can also use it to ask about particular people in the conversation if that is something I'm interested in. I can now create a separate chat here, and I can just ask it basic questions. Again, I would not suggest using AI for diagnosis, but AI can be used to help with basic research, basic information that you don't want to just hop over to Google for example, because this is now an interactive conversation. It can tell you basic information about what's the capital of Hungary, for example. So all very powerful features that are straight in your Halespring HIPAA compliant, secure environment to help make your practice more efficient and more effective, and really help you be a more effective clinician. And we thought that was useful to highlight. So that is actually the end of our product demo. With that, I am going to stop sharing this, and we are going to, I believe, open it up for questions and answers if there are any. I hope that you guys have found that. It may have been a little fire hose of information, but we're trying to be respectful of your time. So hopefully you found that useful.
Attendee says, I often work to send clients to higher levels of care, and the coordination on both the front end and back end can be cumbersome. Are you saying Halespring can be a place where all treatment providers, the therapists, MD, adjunct providers, etc., can communicate and case consult together? And can you add and delete folks? Say an ROI is revoked or they change providers. Can you upload ROIs here also?
Great question. And yes, as Frank's little vignette indicated, that is one of what we believe is the prime use cases and value propositions for Halespring. We didn't highlight it, as you saw. There was a lot we went through today. We didn't have time to cover everything, but in fact, there is a mechanism in the platform to actually authorize given users for given clients, and that includes optionally, I should say, uploading a hard copy of the ROI for that client. And so that can all be tracked in the system. And in fact, this is just how we have it today. We have plans on making that even easier to make it all electronic in the future. But yes, you can add and delete participants to a team at any time if you are the owner or the administrator of that team. And so, for example, a program lead clinician might want to create a team that has both the clinicians from the residential program as well as the outside clinicians that referred to and maybe or referring out from that program, so they can communicate before, during, and after any relevant information. Things like discharge summaries can be shared, and then aftercare or post-care summary, all of that can be shared here, and coordination is much easier there. Frank, anything to add to that?
Spot on.
Okay, great. Next question is, if a client goes to a high-level care, can a facility or hospital add the discharge notes here, and how large can the file be?
Yes, well, so yep, as I mentioned, that absolutely can. We do have a file size limit right now, I think practically of like 100 megabytes or something, which is a very large file. If it's turned into PDF, it'd be very hard to exceed that limit. Of course, if we find that's a problem, there are things that we can do to adjust that. But this is, again, one of the prime use cases we believe for Halespring that will make it valuable to the clinical community.
Yeah, someone wrote, I don't see my areas of specialty on the list. Is there someone I can connect to suggest they be added? Thank you.
Yes, absolutely. And it's right here on this screen. Thank you very much for teeing that up. So first of all, apologies that it's not there, but you send an email to info@halespring.com and let us know what you are missing and what the challenges you're experiencing are, and we will do our very best to help you. And also, if we need to make changes, we will seek to do so as quickly as possible.
Excellent.
Fantastic. Well, thank you, everyone, for joining us here. We are glad that you did and hope that this was useful to you. And thanks again for your interest and support of the Halespring and the Halespring mission. Thanks,
Bye,
Frank.
everyone.
Thanks, Peter. Thanks, everyone. Really
Great.
appreciate your time.
Bye, everyone.
Cheers.